These days, the internet isn't just telling you that looks matter. It's telling you that looks matter so much that you should be willing to radically alter your body to compete. I want to understand where this is coming from and where it breaks down. As a plastic surgeon, my goal here is not to shame or judge, but rather to explore something that's increasingly common and that's important to a lot of our youth.
Looksmaxxing is the furthest extent that you could take self-improvement.
It's this internet ideology where people are treating attractiveness like measurable status.
Looksmaxxing is no longer a fringe internet trend. It shows up in real-life choices that people are making about their bodies. Unlike some short-lived internet movements, looksmaxxing connects to a deeper force, such as our identity, how social hierarchy is created, a fear of falling behind, and a desire for control in an uncertain world. One of the most visible figures in this space right now is Clavicular. Hey Clav. He didn't invent looksmaxxing, but he speaks about it openly and he pushes it further than most. Let's try to understand why looksmaxxing resonates, where it overlaps with accepted medical concepts, where it becomes medically risky, and what it says about how young people view appearance today. At its core, looksmaxxers have the following belief: by optimizing every controllable aspect of your appearance, you can meaningfully improve your life outcomes. And that includes things like body fat, muscle, skin, hair, teeth, grooming, posture, and sometimes pharmaceuticals or procedures. And in a way, people who see me for hair and lip cosmetic surgery may be considered looksmaxxers. And many soft maxing pursuits, like improving our posture for example, overall I think are a positive thing. But the real question here is, to what extent are people willing to go to possibly look and feel their best? At what point is it too much? And can the pursuit of improvement and perfection actually endanger our health? I think it's important to recognize that looksmaxxing exists on a spectrum. On one end, you have diet, exercise, skincare, and trying to improve things like our style. On the other hand, you have things like experimental drugs, self-administered injectables, hormonal manipulation, and some unproven and extreme techniques. And Clavicular operates more to the extreme of that spectrum, and that is partially why his content provokes such strong reactions.
Using different pharmaceuticals and nootropics to try to be as mentally cognizant and sharp as possible.
The only real thing you could do if you have brown eyes is to remove the pigmentation.
You can use retatrutide. That's an appetite suppressant. You're gonna get really lean. Your face is gonna angle itself out. That's the best place to start.
Clavicular is a young streamer and influencer who documents aggressive attempts to optimize his appearance. What sets him apart is not just what he discusses, but how transparent he is about his experimentation and his reasoning for doing the things he does. But when you take a deeper dive, I think the real reason for his success is actually the contrast between his traits and his behaviors. On one hand, Clavicular is articulate and well-spoken. He presents ideas in a structured, analytical way, and he's surely conventionally attractive by most standards. Some may say that he already sits on the top end of the attractiveness distribution. On the other hand, he deliberately uses shocking language, such as racial slurs. He's also openly discussed using hard drugs, such as methamphetamine. And despite already being tall and attractive, he discusses doing procedures such as double jaw surgery and leg lengthening surgery in a very serious way.
I need double jaw surgery. I need it yesterday, and I'm getting it.
And I think humans are generally drawn to violations of expectations, such as when someone has high verbal intelligence but behaves transgressively, or has high physical capital but expresses dissatisfaction, or when someone's already in a very high percentile but is pushing towards the extreme. That creates cognitive tension. The audience subconsciously asks, if this isn't enough for him, what does that mean for me? And I think that question is what keeps a lot of people watching. So part of Clavicular's draw isn't just his ideas, it's the unresolved tension between what he already has and how far he still wants to go. Clavicular consistently argues that our appearance influences social outcomes.
When you are not attractive, your life is hell. I've experienced it. I'm sure a lot of people have experienced it that are watching this right now. And then when you start to get a little bit of good looks, everything changes. It's like a switch flips in your life.
That looks function as a baseline filter for dating, work, and credibility, and that personality matters, but often only after appearance. And many will criticize his perspective as shallow, but I think a more productive question is his belief entirely wrong? Or does it represent an overcorrection to a culture that previously downplayed the role of appearance altogether? And before I go any further, I think it's important for me to state this clearly. There are several things that Clavicular emphasizes that I actually agree with. First is that doing research before choosing a procedure actually matters.
You should be on your computer for hours researching, creating yourself a regimen. How can I ascend? What can I do?
People should understand what they're considering, what the risks are, and what realistic outcomes look like. And I genuinely hope that my channel helps people who are considering hair and lip cosmetic surgery and other plastic surgeries. Not to push them towards doing something, but to actually help them make informed decisions. Secondly, I agree with Clav that choosing the right provider is critical. This is something that Clavicular speaks about often, and I think he's absolutely right.
Of course, if you go about things the wrong way, if you go to surgeons, incorrect procedures, yeah, that can happen.
Results and safety are not just about the procedure. They're largely about who's doing it, their training, their judgment, and of course their experience. And that's the advice that I give in many of my videos, especially in the day and age of people going to all types of places for hair transplant surgery, often thinking more about the country that they would prefer to go to rather than the specific doctor to select. It's much more important to consider who's the specific doctor responsible for your care rather than choosing a random clinic or country based on social media. Third, I think Clav is right about his thoughts on fillers.
Filler's gonna migrate. It doesn't stay in one place and it never dissolves. It can block lymphatic drainage in your face. The worst is in the jaw. It starts to migrate into your submental and you just look like you've got this turkey neck. Filler was never meant to replicate bone. That's what implants are for.
Overfilling and migration are big issues when it comes to filler. In both men and women, excessive filler can distort facial proportions and create results that look unnatural over time. Conservative use, proper indication, and restraint matter a lot. More on that in a little bit. And finally, I do agree with Clav that looks do play a role in our society. They affect how people feel about themselves and how others initially judge them. Pretending otherwise doesn't really help anyone. Appearance is not everything, but it's not nothing either. And recognizing that reality doesn't mean that you have to obsess over it. It means approaching it with the right balance and perspective, just as you would most other aspects of life. Now let's talk about specific techniques that Clavicular discusses, and let's evaluate them through the following lenses. First, how it's framed. Next, what biology and medicine actually support. And of course, we need to discuss the risk that is involved. Fat-dissolving injections are presented as a shortcut to sculpting our jawline and cheeks without the need of surgery. These injections involve deoxycholic acid, going by names such as Kybella or Aqualix. These are cytolytic agents that dissolve fat cells by disrupting cell membranes. These affect soft tissue, not bone, and outcomes depend heavily on anatomy and technique. But remember that deoxycholic acid is not selective for just fat. Injection too close to a facial nerve branch can actually damage the myelin sheath, and this can lead to facial weakness or asymmetry. And though these effects are rarely permanent, when the deoxycholic acid is injected into indicated areas such as the submental region, the results could potentially be more lasting if the injections are placed into areas that are not approved for injection of this type of substance. So deoxycholic acid is not approved for injections into the face, and facial nerve injury could be higher in the face compared to the neck. You also get irreversible fat damage with deoxycholic acid, and that can actually lead to a more aged appearance over time. Check out my video on buccal fat removal to hear more about what happens when you remove facial fat earlier in life, how that then translates to our appearance later in life. There's also, of course, the risk of infection and scarring that is going to be higher with self-administering this stuff at home, especially without gloves. I've seen Clav inject injecting the stuff into a woman without any gloves or any sort of disinfection. We should also mention that injecting these substances at home without the proper licensure is actually illegal. So let's not forget that important point. Even doing these types of injections as a DIY, injecting yourself and obtaining these substances through roundabout ways is also highly illegal. Clavicular views filler with skepticism because of its ability to migrate and distort natural anatomy. And Botox he describes as primarily preventative.
I'm a big fan of Botox, but people go about it wrong. It's not something that you could do after you've already achieved or after you already aged and accumulated wrinkles. It's a preventative measure because the wrinkles occur as you express your face. So it's about preventing that.
While I do agree with him that Botox can be preventative when it comes to wrinkles in various areas of our face, it can also be therapeutic from the standpoint of even if you have some lines that have already formed and you're looking to smooth out the skin, the use of Botox can still be quite effective. Of course, if the lines are very much deep and very etched in, it's going to be difficult to completely resolve that with Botox, but in more mild cases, it can be effective as well. And filler, I would argue, can still provide contour illusion when used conservatively and appropriately, so it shouldn't be something that we completely shun away from, but rather it should be used with caution and precision and by experienced providers, not by someone obtaining the stuff illegally and using it on themselves at home or on their friends at home. Improper dosing, placement, or non-medical injection increases the risk of asymmetry, vascular compromise, migration, and long-term distortion. And at-home administration removes critical safety checks. And filler risk has been discussed extensively on this channel, and here's a video if you want to learn more about it. Hormones are discussed as tools to influence masculinity, body composition, and overall presence.
Right now I'm on 280 milligrams of testosterone.
And some stated caution about starting it too early. But let's not forget the profound importance of hormones for our growth, development, and metabolism. Exogenous hormone use alters natural endocrine signaling and can permanently change developmental trajectories. This is not something to be taken lightly. Use before full biological maturation can increase the risk of irreversible endocrine disruption, cardiovascular strain, hepatic injury, fertility impairment, and can have long-term metabolic consequences. Many of these risks are delayed and not immediately apparent. Facial leanness is emphasized as one of the most impactful appearance changes. While lower facial fat can definitely increase definition, it can also accelerate visible aging and can reduce soft tissue support. That's what we've been seeing with things like Ozempic face. As people are on these GLP-1 medications, they lose a lot of that facial fat volume, and then things look more gaunt and sometimes they look a bit older. And then people go and get fat transfer procedures to rebuild the fat in their face. It's also important to remember that stimulant-based appetite suppression carries addiction risk. It can also lead to cardiovascular stress and can have serious neuropsychiatric consequences. So the way in which we lose the fat in our faces, if that's a goal that someone has, is extremely important. They're not all created equal. So there are healthier ways to lose that fat, and then of course there are more dangerous ways to lose that fat. Now let's talk about one of my favorite topics, which is hair loss. Early intervention with medical therapy is emphasized, with discussions around finasteride, minoxidil, and dutasteride, and overall I support this type of discussion. I think that's much healthier than people just jumping into hair transplant surgery at a young age. And I've definitely heard Clavicular speak intelligently about this topic.
So you've got 5-alpha reductase. That enzyme converts testosterone into dihydrotestosterone. So basically what we're going to do is we're going to inhibit this interaction right here. We're going to inhibit this enzyme so that this process gets cut off. But there's actually two types of 5-AR within the enzyme, right? So there's 5-AR1 and there's 5-AR2. So this one is the one that's responsible for our hair loss. This is what Finn blocks. But this is a bit of a weaker 5-AR. This is really only going to block about 70% of only one of the types of the 5-AR enzyme. So dutasteride is going to block type 1 and it's going to block type 2. Dutasteride is also going to block 95% of type 1.
These medications help stabilize hair loss and in many cases help improve the appearance of our hair. But these are prescription medications that need to be used appropriately with proper patient monitoring. Unregulated compounds, home formulated treatments, and incorrect dosing increase systemic exposure and unpredictable side effects. And as with a lot of this stuff, emotional urgency can sometimes drive unsafe experimentation. If you're interested in understanding more about these medications and potentially getting on them, you can go to feelconfident.com. And remember that sometimes hair transplant surgery is very much useful and safe even in younger patients if they're properly stabilized on medical therapy first. Clavicular justifies bone smashing of the face by using Wolff's Law and claims that repeated trauma will stimulate facial bone growth.
This is an OG bone smash. I used to look like this before I went to work every day, and people would always ask me like, what is wrong with you? I was like, and I don't know, bone smashing?
But the problem is that facial bones do not remodel constructively with repeated external trauma. Wolff's Law applies to controlled load bearing, not blunt force injury. And repeated facial trauma has many risks, including nerve injury, soft tissue damage, chronic pain, facial asymmetry. So put that hammer down because it's probably going to hurt you much more than it helps. Chewing and resistance training are promoted as ways to increase jaw width and strength.
Mewing is dope, and it's actually required during development. If you have improper tongue posture and improper breathing habits, then you're not going to develop correctly. You could have the best parents in the world, best genetics, but if you've got horrible habits, you won't develop into the best version of yourself. So definitely dope.
Jaw training can of course hypertrophy our muscles, but it does not alter our mandibular bone structure. And overuse of these techniques can increase the risk of temporomandibular joint dysfunction, pain, and bite imbalance. And for many people, this actually has a minimal aesthetic payoff. Meanwhile, people are doing things that can increase their risk of other problems that is going to be much more difficult to solve later on, such as TMJ pain that might become chronic. Skin quality, tanning, and cosmetics are presented as high-impact, accessible tools. Of course, healthy skin can improve light reflection and the perception of vitality, and cosmetics can enhance contrast and symmetry. But UV exposure and tanning will actually accelerate skin aging. And most importantly, it will increase skin cancer risk. And something that Clavicular talks about that we need to break down here is melanotan.
I often get the question, or I see people saying, well, I tan really easily. Do I need MT2? Absolutely. The answer is yes. If you are a Looksmaxxer, your goal should be to get as tan as possible for certain phenotypes with minimizing your exposure to UV, because UV is horrible for your longevity, right? We know it affects collagen in a very negative way. So if you could get to your desired result without any of the detriment, there's absolutely no reason not to.
In fact, it does not protect against UV damage, and it introduces some very serious systemic health risks. It's actually been associated with increased skin cancer risk, kidney dysfunction, and brain swelling. Clavicular talks about cosmetic surgery as an investment that can potentially multiply attractiveness and social return. And Clav has been planning a double jaw surgery for quite some time.
So the surgery is called a Bimax. It's a double jaw surgery, right? So they're going to make an osteotomy in the upper jaw, my maxilla, and advance it forward, and the lower jaw. It's called a BSSO, and advance both of the jaws forward. And on top of that, during the same process, during the same hospital stay, to save money, they also place the implants.
But we need to remember that surgical outcomes are generally irreversible, and the success of surgery depends very much on someone's starting anatomy, the indication for the procedure, proper surgical planning, and then of course the execution of the surgery itself. And there are many risks of cosmetic surgery which we talk about extensively on this channel. Some of the general ones include the following: infection, nerve injury, dissatisfaction, need for revision surgery, and psychological distress. But most importantly, surgery cannot be completely undone. So when we're considering surgery, it needs to be taken very seriously. And we need to make sure that we're not just chasing the latest trend, but we've really considered every other alternative, and all roads still point to surgery for us, and that we've done all the proper homework and the research necessary to make an informed decision. Only then should someone really proceed with cosmetic surgery.
Oh, this guy looks crazy. What the?
I like your guys' outfits.
I don't.
Definitely need intraorbital implants right here.
The worst thing about you is probably your lower third.
I wanted to comment here on one pattern that comes up repeatedly in Clavicular's content, and that's approaching people, rating them on how they look, oftentimes calling them unattractive, and listing changes that they need to make in order to look more attractive. That kind of content gets attention, but to me it raises a lot of concern. A person's external appearance and their inner sense of self are not always aligned. Some people feel confident without thinking too much about how they look. They haven't necessarily identified appearance as a problem, and they might be functioning very well socially and psychologically regardless of how they look. So when you tell someone like that they're unattractive, and especially when it's unsolicited advice, you risk creating a problem that didn't exist before. And that's fundamentally different from helping someone who, say, comes in with a specific concern, such as someone who's already distressed about a specific feature of how they look, and someone who's actively seeking guidance or options about something that's bothering them. There's a meaningful difference here between offering advice to someone who asks for it versus imposing a critical framework on someone who didn't invite it. One approach can be supportive while the other one can be destabilizing. As a plastic surgeon who works with appearance, this distinction is deeply important to me. And what makes this especially striking is that Clavicular is conventionally attractive, yet he frequently talks about needing these extreme interventions to be enough. I think one of the important lessons here is that external metrics don't necessarily always translate to internal satisfaction. You can optimize appearance extensively and still feel inadequate. Sometimes there's a deeper problem that people are not addressing. Instead, they're looking to some of these cosmetic changes, thinking that it's going to transform their lives, when in reality they're barking up the wrong tree. And I suspect that Clav, to a degree, might fall into this category. I don't believe that we should make people feel worse about themselves. We shouldn't create insecurities where none existed before, and we shouldn't suggest that everyone needs to be constantly fixed. Helping someone feel confident is not the same as convincing them that they're deficient. And if someone already looks great, but they feel like they need some radical changes, that should make us take a pause and not just follow blindly. I think in general, advice should relieve distress, not create more of it. Looksmaxxing is often framed as optimize until you reach the top, but Clavicular's case quietly exposes something else. There may be no finish line at all. Achieving the highest ranking does not guarantee happiness, and optimization can sometimes slide into unnecessary escalation. When someone already near the extreme talks about going further, it challenges the idea that there is a stable endpoint to aesthetic self-improvement. In conclusion, I think there's nothing wrong with trying to optimize our appearance, but treating our body like an experiment is sometimes where curiosity can turn into harm. If you're young and watching this video and have some interest in looksmaxxing, consider starting with soft maxing first. Things like improving our sleep, our diet, our posture, those are all positive things that we should all be thinking about no matter our age. But if you're looking to address a specific concern that you have, and it might involve, let's say, a procedure or a surgery, well, then you have to seek the help of professionals who can help guide you. Always be skeptical of shortcuts and think about what long-term effects can look like, and if you're potentially hurting your future by the things that you do today. We need to respect long-term health, not just how we look and feel today. Don't let honest self-exploration turn into self-destructive optimization. If you guys think that I should have a sit-down conversation with Clav where we flesh out some of these ideas and where I really challenge him on some of what he discusses, please let me know in the comments below, and make sure to comment on some of his live streams for him to come visit me in New York City where we can talk about this some more.